We know from the research that there are things that make people more vulnerable to developing problems related to substance use. And that includes things like adverse childhood experiences, trauma. That kind of trauma includes being a survivor of oppression and racism. It's one of the reasons why we see a lot of problematic substance use among LGBTQ individuals, for example, is because many of us in the LGBTQ community have survived trauma, whether it was childhood trauma or trauma as adults or violence or just the isolation and lack of connection and lack of community. When communities experience oppression, marginalization, lack of socioeconomic opportunities, they are more likely to see high rates of substance use disorder. When you look at the Native American community in this country, for example, which is a culture and a people that it's experienced generations of genocide and cultural dislocation, the intentional disruption of family networks and family ties, and incredible economic disparities, it's not a surprise that we see higher rates of substance use disorder among Native Americans in this country. One of the most direct connections between substance use and HIV is the fact that people who inject drugs were one of the first populations that were susceptible to a bloodborne virus like HIV. We also know that for some gay, bi, queer men, their substance use to self-medicate around pain, shame, stigma, trying to manage their sexuality, isolation, lack of community, so on, led them to use substances in ways that created risky sexual behavior. And so substance use among gay men has, in and of itself, has led to increased HIV transmission among gay, bi, queer men. In this country, some drugs are legal and some are illegal. The most common substances of use and of problematic use are the legal ones. So tobacco, nicotine creates enormous health problems and health challenges for people everywhere, and it is legal. Many people assume that drugs are legal or illegal based on some actual thoughtful process or determination as to what creates harm for people or families or communities and what doesn't, but it couldn't be farther from the case. The smoking of opium was first made illegal here in San Francisco in the 1870s as an anti-Chinese effort, an effort to control the immigrant Chinese population here. When you look at why substances are legal or illegal, there is almost always an undercurrent or even a very overt current of racism and racial control in it. There are a variety of treatment options for substance use disorder. There is a continuum from harm reduction services through to residential treatment programs and abstinence programs. The type of treatment that's available also depends on the substance. So opioid dependence, for example, is best treated with methadone or buprenorphine, Suboxone. Alcohol, there are a few medications for. We don't currently have any medications that are useful for stimulant disorders. Overall, much of the treatment in the United States is fairly heavily based in the 12-step approach. And even though 12-step is not a treatment per se, but it often gets used as a treatment, but I would even say misused as a treatment. 12-step programs are extremely effective as social support for the people for whom they work, but 12-step programs don't work for everybody, and they can create their own set of stigma and shame for the people for whom it doesn't work. Harm reduction has a number of different definitions, but essentially it's a philosophy around recognizing that we will never get rid of all of the risks related to something, but we can figure out ways to make it safer. So in this current COVID-19 era, masks are harm reduction, hand washing is harm reduction, keeping a 6-foot distance is harm reduction. It's not eliminating our risks, but it is reducing them substantially. When it comes to drugs, we think about harm reduction as ways to both reduce the harms of the individual substances themselves. So that can look like naloxone to reverse opioid overdoses, using a sterile syringe to prevent transmission of HIV or hepatitis C or other viral hepatitises. And then harm reduction is also at the larger social and cultural level around reducing the impact of the war on drugs and the impact of the criminal justice system on people who use drugs. What we have in the U.S. today in terms of harm reduction services, syringe access in particular, we owe entirely to people who use drugs. They created these programs and these services out of nothing, out of a desire to help themselves, help their community, help their family members. Here in San Francisco in 1989, a very brave group of volunteers that included people who use drugs, friends and family members of people who use drugs, researchers, people in recovery, took it upon themselves to try to address HIV transmission among people who inject drugs. And they took a baby carriage and filled it with sharps containers and sterile syringes and rolled it around the neighborhood, reaching out to people using drugs to ask if they wanted to have sterile syringes. So this happened on Day of the Dead in 1989. They intended for it to be civil disobedience, and it turned into a long-standing program. It's recognized by the Centers for Disease Control, by the World Health Organization, as one of the most effective HIV prevention tools that we have. Among the biggest predictors of people being successful in treating substance use disorder and in changing their relationship with drugs is having the kind of socioeconomic supports that we all want and need and deserve. So when people are unhoused, it makes it that much harder to effectively change your relationship with drugs. Being unhoused, being homeless is, for many people, why they use drugs. They take stimulants, they take meth to stay awake all night and protect themselves. People may use heroin and other opioids to address the pain of, and the difficulty of trying to fall asleep on the sidewalk, which is what they have available to them. So, being unhoused is often the reason why people use drugs. We often see it as the result of people's substance use, but it is also often a reason why people use substances. Even people who are upholding the criminal justice system, whether it's police or district attorneys or so on, will often still say we can't arrest our way out of this problem. We can't arrest our way out of drug use. And the kinds of trauma and dislocation and disconnection that can happen to people through being criminalized and through being incarcerated, again, creates additional vulnerabilities to developing problematic substance use. The fact that we arrest and criminalize people for health diagnosis of substance use disorder, refuse to provide them treatment, even if they had been prescribed methadone, for example, before they were incarcerated, and then release them back to the community without doing anything to address that, is one of the biggest sins in this country, to use moral language. Yeah, I think it's immoral.